Hello everyone, a very good morning to all of you. So today let's talk about renal system. Okay. So before moving into the renal system, I'll explain you very basics and the outline of what is glomerulus and what are the few structures present in the glomerulus. So once you know these basics, whatever disease I'm going to put in, it will be very easy for you to orient. Okay. So before moving in, so these violet structures, what you see here is a glomerular basement membrane. Okay. So the glomerular basement membrane has collagen, laminin, and a few ground substances. Okay, so this glomerular basement membrane is responsible for prevention of proteins or excretion of proteins in the urine. Okay, so they are going to prevent protein excretion, especially albumin, plasma proteins, albumin. So am I right in saying that any disease that is affecting the glomerular basement membrane is going to result in what is called as proteinuria? Okay, so glomerular basement membrane, it is predominantly as collagen, laminins and ground substances. So it is mainly responsible for prevention of protein excretion. Okay, so it has positive repellents, like it will move away the negatively charged molecules. Okay, and now between the glomerular basement membrane, there is two structures surrounding it. Okay, so the first structure what you're going to see is the endothelial cells. Okay, so you can see these round structures here, they are called as endothelial cells. So the endothelial cells, if you see, it is very important because endothelial cells predominantly functions to participate in inflammatory responses. Participate in inflammatory responses. Okay, another one very important feature of endothelial cells is they prevent the excretion of the RBCs, WBCs and the platelets. Okay, prevent excretion of blood cells. Okay, so am I right in saying that any damage to the endothelial cells is going to result in what is called as hematuria? So glomerular basement membrane destruction, proteinuria, and endothelial cell destruction is going to result in hematuria. Okay, very simple. Now moving on to another structure called as podocytes. So you can see a structure which is surrounding the endothelium, surrounding the glomerular basement membrane. This structure, the brown structure, is called as the podocytes. So podocytes, if you see, it is very similar to the glomerular basement membrane. It is going to prevent the excretion of proteins, larger molecules, larger proteins. It is going to prevent the excretion of larger proteins, and it is responsible for ultrafiltrate. Okay, now moving on to another last structure that is called as mesangial cells. So mesangial cells, if you see, they do not participate in filtration. Okay, they do not have any role in filtration. No role in filtration, but they cause what is called as contraction. That is, in that way they are going to help in glomerular filtration rate regulation. Okay, they help in contraction, so they regulate the GFR. Okay, so they have no role in filtration, but they regulate the contraction, they regulate the GFR. So am I right in saying that any disease that is going to result in proliferation of these mesangial cells, right? So these mesangial cells, if they proliferate, if they become big, that is going to affect the GFR. That is what I am going to call as proliferative mesangioglomerulonephritis. Okay, okay, now these are all the very basic cells. You have glomerular basement membrane, the podocytes, endothelial cells, mesangial cells, and of course we have epithelial cells surrounding it. Okay, now moving on, I'll tell you a few scenarios where there is going to be a fight between antigen and antibody. See, antigen antibody reaction is usually common. Okay, antigen is any foreign drugs, toxins, or any kind of endogenous like nuclear proteins or tumor antigens, whatever it may be. Any antigen enters, the antibody is going to bind, it is going to attack, it is going to kill it. Okay, so what is the pathway? So any antigen enters the body, it is going to be grabbed by the antibodies, especially IgG and M. So once these antibody trap these antigens, what is going to happen? They're going to stimulate the complement system. So there's going to be stimulation of complement system. So that is going to result in opsonization and phagocytosis. So these are later eliminated by macrophages in the spleen and the kidney. Macrophages eliminate it. So this is the normal process. So antigen comes, antibody binds to it, then there is going to be activation of complement pathway, opsonization and phagocytosis that is going to result in macrophage. The macrophages eliminated in the liver and the kidney. This is a normal process happening. Now imagine when there is more of antigen being produced, when there is more amount of antigen secreted, the antibodies couldn't able to control it, or couldn't take charge of it. What happens? Say for example, in certain situations like streptococcal infections or IgA nephropathy or neuropathy, lupus nephritis, autoimmune diseases. So in these few situations, what is going to happen is there's going to be increased antigens. So when there is increased antigens, the antibodies which is produced by the body will not be able to compensate for it. Okay, so what happens? These antigens, they start slowly depositing over the surfaces, blood surfaces. Okay, so what happens? The endothelium of the blood vessel, there is going to be increased amount of antigen deposition. Okay, so obviously the organs which is going to receive more amount of blood, it is going to be affected, or it is going to have more amount of antigen. It is obvious, right? Because there is more amount of antigen present in the body. Because of any of these situations, the blood carries the antigen and reaches the organs which wants or which is receiving more amount of blood. In that way, kidney is one of the organ which is receiving more amount of blood. So what happens? These antigens, they start to deposit in the endothelium. Okay, plus mesengium plus podocytes. So what happens? So because the kidney receives more amount of blood, these antigens come through the glomerular capillaries and they deposit on these structures. So as I told you, endothelium is responsible for the control of the excretion of blood cells. Mesengium, again, it is going to helpful for contraction. It regulates the glomerular filtration rate. Podocytes, it is going to control what is called as the excretion of proteins, albumin or proteinuria. Okay, so once these structures, they are going to get more amount of antigen, what is going to happen? Our body is going to respond in the form of production of antibodies. So there is going to be antigen antibody complexes. Okay, these complexes, again, as I told you, it is going to stimulate complement system. So opsonization, phagocytosis is going to take place. Always remember, whenever there is phagocytosis, it is not only the bacteria or the antigen which is going to get eliminated. At the same time, our own normal cells will also get affected. Okay, why? Because they release reactive oxygen species, they release some processes, they also release some toxins. So what happens? Because of the numerous antigen depositing on the walls of the podocytes, on the mesengium and the glomerular endothelium, more amount of antibodies are produced. So more amount of immune complex reaction takes place. So a lot of reactive oxygen species are released, and there is going to be a lot of fight between the antigen and the antibody. That is going to result in destruction of these structures. Okay, that is going to result in destruction of glomerular endothelium, mesengium and the podocytes. So now you are going to tell me what happens when there is destruction of glomerular endothelium. There's going to be hematuria, blood is going to get excreted because there is a damage. What happens in mesengium? Mesengium is responsible for the contraction. So what happens? There is going to be proliferation of the mesengium. Because of the inflammation, that is going to result in decreased GFR. Okay, and what happens to the podocytes getting damaged? Increased proteinuria. Now you can ask me, when there is decreased GFR, there should be decreased hematuria or decreased entry of the blood. So there should be no or very less proteinuria and hematuria, right? So always remember, the proteins, they do not depend upon the mesengium. Okay, even if any small amount of blood carrying proteins will be completely eliminated, because the proteins depends upon the podocytes and the glomerular basement membrane and not the mesengium. Okay, so that is the reason even the small amount of blood is coming along with the proteins, it is completely eliminated. That is the reason even in GFR you get proteinuria and hematuria. Okay, so these patients will have proteinuria, hematuria. Okay, and also there is going to be decreased glomerular filtration rate. Okay, so now I'm going to tell you a very basic, this is what happens in glomerulonephritis. Okay, it makes sense, right? So I'm going to tell you a very simple difference between nephritic syndrome and nephrotic syndrome. Okay, see, nephritic syndrome, it is going to result in damage of the endothelium. So when there is endothelial damage, there is going to be increased RBC in the urine. There is going to be hematuria, and there is going to be decreased protein elimination. Okay, why? Proteins depends upon podocytes and glomerular filtration membrane. Now, what is nephrotic syndrome? Nephrotic syndrome is basically due to damage of podocytes. So, opposite to it, there's going to be increased proteins, proteinuria, especially albumins. Okay, so this is the very basic difference between nephritic syndrome and nephrotic syndrome. Okay, and of course end stage, it's going to be result in increased sclerosis of the capillaries, that is going to result in chronic kidney disease. So this is a very basics of the renal system. You should know what is glomerulonephritis, what are the causes of glomerulonephritis, like post streptococcal glomerulonephritis or IgA neuropathy or lupus nephritis, all the autoimmune diseases, and why these immune complexes causing damage, and what is the significance of podocytes, endothelium, mesangial cells. And if you know the basics, you can apply this and you can easily tell the clinical features and the symptoms. Okay, so treatment, you have to treat the cause, and you have to take the patient to bed rest and monitor the vitals. Okay, so this is the very basics of renal system. I hope this video makes sense. So thank you so much for watching the video. Have a nice day.